Welcome everyone to our final session of the 2027 Match Summit. The journey to practicing medicine in the United States as an international medical graduate can be incredibly rewarding, but it also comes with unique challenges, from navigating the residency application process and visa considerations. There are a lot of things that go into the application process, and that is why we're thrilled to have our speaker with us today. Joining us is Dr. Rajeev Iyer, professor of anesthesiology and critical care at the University of Pennsylvania, founder of IMG Secrets, and a mentor to hundreds of IMGs, sharing practical guidance on building a stronger residency application, navigating the matches in IMG, and understanding evolving visa and licensure considerations. We're excited to get started today on the final session. Thank you so much again for being here with us, Dr. Iyer.
Thank you. Here is a real story of an IMG, and she's from India. She did her medical school in the year 2002 and then completed her medicine residency in 2006. Both of these from India. She moved to the USA because of family reasons. Her husband is a radiologist and he moved through the alternate entry path in radiology. And she ended up focusing heavily on her family. 2 children, one of them complex need, and then had a gap of 20 long years clinical gap. Then finally, she decided to get into some healthcare assisting process. She managed to get in. It was a completely non-licensed job, but something that got her close to healthcare. And she matched 2026 in internal medicine in Colorado. Now, how cool is it? There is always hope if you do the right things. I'm Rajeev Iyer. I'm a professor of anesthesiology and critical care medicine at the University of Pennsylvania. Now, as Marisa said, I founded both IMG Secrets, where we help graduates across their medical careers in USA, Canada, and many other countries, and also IMG Recruitment, where we specialize in recruiting IMGs through all the various different pathways. I do have to give you a disclosure that neither of this is affiliated nor endorsed by University of Pennsylvania, and everything I'm going to say is my own opinion. Initially, when I got invited to do this, what I thought was I'm going to speak more about the non-US residency pathways. But however, when I got questions from Marisa, it looked like many of you were focused on residency options. So I'm going to spend more time on the residency options. Of course, I'll be happy to take any questions on the non-US residency options. Just to complete the picture, I do want to mention that the non-residency option is for those people who have completed their home country residencies and enter the US system either through fellowships. This could be an ACGME accredited fellowship or a non-accredited fellowship, or through all the new state laws that you have been watching that has currently been passed in 24 states. More and more states are doing this, or directly as a staff job. So these are the ways you can transition. This does not mean to say these are easier pathways. These are actually even more harder than matching, but these are potential pathways for many of you. So when I received all the questions from Marisa, I decided to group them into various categories. And I actually will speak about each of these categories. Now, these are the questions posed by some of you. And I just group them in such a way that hopefully it's going to help you out. The first thing is US clinical experience. Everyone feels I must need a US clinical experience. If I don't have it, I'm not going to match. Now, people treat this like it's a one-to-one relationship. But let me tell you this. The most valuable US clinical experience you can have is called a clerkship. Now, clerkship, by far, it's all semantics, but let me say this. A clerkship is done during medical school. Now, your medical school in your home country might have some relation in the US medical schools. We see this very commonly from the Caribbean medical schools. And you come to the US, do some clinical rotations, you go back, complete your medical school. The second best option we see are externships, where an intern comes, does some rotations in the US. And finally, we have observerships. An observership is something you come in, observe, and go. If you do an observership in a large hospital system, those are very valuable. Now, if you do a paid observerships, they generally tend to be less valuable. So, bottom line, you really don't have to need US clinical experience unless you're able to get one. We've seen people match even without US clinical experience. Again, think of this that a residency match application is like an entire package. You walk into a restaurant, you're hungry, you want to eat a buffet, you see how many things are there. So that's how you think based on that. It is not like if you don't have US clinical experience, you cannot match, but it certainly helps for many candidates, if not for all. But I have to emphasize, it is not an independent predictor of success. Meaning, just because you have US clinical experience and the rest of the applications doesn't look great, does not mean you're going to match. Every single thing has to be precise and appropriate and perfect. Okay, there are some red flags I want to say when it comes to US clinical experience. Now, I get a message on LinkedIn that says, I notice you're exploring US clinical experience opportunities. I'm not. Okay. I'm working here, so I'm not exploring any opportunity. And this person says, I've been assisting students in IMGs with rotations and LORs. So, which means this person, without even knowing me, is ready to give me an LOR. So, that's a huge red flag because basically, to me, it looks like you pay me money, I'm going to give you an LOR. Now, as a program director, if I'm looking at this, I see where this comes from, I would know what's going on. So you have to be extremely careful when you take these US clinical experiences that are completely commercially driven. Many times, if a place takes, sometimes 30, 40, 50 candidates, and everybody is interested in applying for, let's say, internal medicine, all these folks will have the exact same looking templated letter of recommendation, the only change being their name, which is a problem. In fact, I have been to program director summits where some of these observerships have been red flagged, and program directors view this in a negative way if you have a rotation from these places. So be extremely careful. If you do it in a reputed place, definitely go for it. All right. So the next big category is about research and publications. Now, this obviously is an important factor. It certainly shows that you're dedicated to the specialty. Ideally, you want to get it started during your medical school. Not always possible. And one of the frequent questions we also get is, how many publications are required? There is no magic number. The quality is always more important than the quantity. I'll give you an example. Now, let's say you have one publication in New England Journal of Medicine, and you have 30 publications in, like, let's say, Curious or some other journal where you pay money and get your publication. Which do you think is more valuable? That is exactly how you think about this. If you're unable to do publications, focus on doing abstracts, present posters, get involved in ongoing research. All these are going to benefit you when you think of research and publications. One of the other concern is, this is an especially an IMG problem, that I do not have anyone doing research in my home country. They're all focused on clinical work. That's fine. You can start with simple things like case reports, case series. If you want to go a step further, you can do educational reviews. You can think of systematic reviews and meta-analysis. There are a lot of freely available courses on how to do them. And in fact, you can collaborate with a few and then do these articles. You do not need any IRB approval. You do not need any special permissions for this. As long as you follow all the rules and ethics required for a publication, you should be good to go. There are some red flags that people do. So one is publishing in predatory journals. These are those journals which actually asks you money and publish anything, just anything that you submit to them. Now, I'm on the editorial board of a few journals. And when we have the editorial meetings, our editor-in-chief has made it sure that if any of you publish in a predatory journal and downstream, if a patient has a problem because of that, you can potentially be liable for a lawsuit. So keep that in mind when you publish in crappy journals. This is a big deal. And also the other thing I see is social media is filled with paid research. They say, you know what, join our team, pay me money, I'm going to make you an author. This is unethical, this is fraudulent. So be extremely careful when you pay money and get a name on the journal, especially when you did not contribute, because if you get caught, you're basically done. Keep in mind. Okay. All right. The next big category, visas and sponsorship. Of course, you're an IMG, you need a visa, right? Most programs, especially in the current scenario with the present administration, sponsors J1 visas. This is because it's very straightforward to sponsor a J1 visa. It's less expensive for the programs. It's less paperwork for the programs compared to an H1B. The J1 visas are sponsored by ECFMG. So when you're applying, don't worry about whether a place is sponsoring a J1, H1B. Just focus on whatever sponsors a visa. And sometimes when we are helping candidates, we don't strictly go by which program sponsors a visa, because sometimes we use our judgment to even apply to programs that say they don't sponsor a visa. Again, you don't want to waste too much time and money there. You have to make these decisions extremely carefully, okay, using a lot of experience there. Again, there are a lot of visas. There are 56 different types of visas in the US, at least the last time I saw. But for an IMG, there are only 3 that are relevant. It's J1, H1, and an O1. If you're applying for residency, you're looking at only J1 or an H1B. If given a choice, obviously H1B would be the visa to take. Again, not easy to get because transition to a green card is quite seamless with an H1B visa. The J1 requirements, of course, I assume many of you know this, comes with a waiver requirement or a home country requirement. In our experience, we have not seen anyone go to their home countries, but rather everyone has been able to secure a J1 waiver. This is for residency match, but there is an exception. If you come directly for a fellowship in the US on a J1, then transitioning to next steps, you have to be extremely careful when you're looking for a job under a J1 without having any US residency. Now, that's a completely separate concept. Okay? All right. Some of the red flags you need to keep in mind is you have to know your program. Okay? Again, as I said, we don't always follow what's published. We use our judgment. Now, here is a critical thing I want to mention. These are for people who actually have a green card pending. Now, what happens is, if someone has applied for a green card, they actually say, okay, I've already applied for a green card because they want to increase the chance of their matching. Now, the program sees this. The program thinks this person has a green card. They give them a spot. And then your green card, for some reason, administrative delays, whatever it is, doesn't come before June of 2026 or 2027, actually. So if you have a green card pending, be extremely cautious. Speak to your immigration attorney, speak to your program, be very transparent about this. The last thing you want is you got a spot, but you can't get a visa. You don't want to be in that situation. There are people who are there. Okay? All right. The next category is about the IMG friendly programs. I was looking at a couple of lectures this morning. I think this has been really well covered, but I do want to mention that look at the visa, look at the IMG track record, and also the step 2 score fit may be a critical factor. One of the things you need to think of is your fit good for a community program or for a university program or for something in between. Now, this is a determination you have to make in terms of applying to the next steps, okay? Again, remember, it's the entire package they're looking at. If a program director is seeing there is not one factor that's going to be an independent factor in success, but they look at the entire package. So make sure you provide extremely high quality applications and sell yourself in a nice way, okay? And when someone says IMG friendly programs on social media, just use your research to find out the objective data. Just don't exclusively rely on that. Geographic preferences do matter. Now think of using signals in a very sensible way, because signals actually do make a difference, okay? The scores get you to the program, the rest gets you matched. You know, there is a saying, you can get the horse to the water, but you can't make it drink. All right, okay? So the next category are those people who are older graduates. The older graduate, by definition, is not old by age, but someone technically is more than 5 years after their medical school graduation? What happens if there are any gaps, if there are other kinds of red flags? What we have seen is more critical is having a recent clinical experience. Now, think of our own candidate as example. How did she match after 20-year gap? This is because she was able to get some recent clinical experience, plus able to put a very compelling story to state that why she has to get back to residency all over again. So your story has to be very compelling. Generally, when we write personal statements, we don't start with, Hippocrates said this, Edison said this, Aristotle said this, and things like that, but rather say what you need to say about your own self. Now, what they're looking is very simple. Let's say you're applying for surgery, anesthesia, and other specialties. Can I trust this person in the operating room? Is this person responsible enough? Can I see this person as a colleague? It's a simple thing that the program is deciding. Okay. Now, generally, the extremely competitive specialties for IMGs are anesthesia, dermatology, radiology, and any surgical specialty, with the exception of transitional year. What is referred to as the IMG-friendly specialty generally are internal medicine, family medicine, pathology, and pediatrics. And when I mean IMG-friendly, remember this is not across the whole of US. Even the top programs will not take an IMG. Now, let me give an example of, let's say, pediatrics. If you're applying for Boston Children's, Cincinnati Children's Hospital of Philadelphia, Texas Children's, they're very unlikely to take an IMG because they get so many local graduates who are outstanding during their medical school. They have done so many different things to prove their value. So when I mean IMG friendly, these are probably the non-bigger places which you can focus on. Okay. All right. I do want to mention that the IMG friendly concept is applicable only for US residencies. Now, when you think of applying directly for fellowships without any US residency, or directly for attending or staff jobs, now this could be with USMLE, without USMLE, it doesn't matter. The IMG friendly concept does not exist here. Okay. These are open for all 50 states. Now, what happens, unfortunately, if you are not matched? Now, this is a critical thing to think about. Hopefully, you don't need to get there. Okay. Hopefully, you don't have to worry about it because you already matched. But let's say this happens, because this is bound to happen, right? Then your option should be thinking of how can I build my profile through research fellowships. There are many bridge options, especially called graduate physician, associate physician, available in many different states. Okay. These are meant for people who have not matched into residency programs. And this is a great option to get clinical experience in the US with a license, using which you can build your profile and then subsequently apply for residency match. Because this alone won't get you a full license. These are, that is why I label them as bridge options, because it provides a bridge from medical school to residency. When you're not working, you can do these things. Of course, there are other things many IMGs do, technologist, assistant jobs, because once you get through these routes, it gets extremely difficult to match. So be extremely cautious what next steps you pick when you're applying for residency match. Now, of course, you have to be prepared for SOAP. Nobody likes this, but again, make sure you're prepared early. And more importantly, think of, are there any non-residency options available for you if you're eligible? Now, we have built a tool on imgsecrets.com. It's called Find My Pathway. It's free. You can go there, put some of your questions, your background, everything. We've created an algorithm that gives you some of the options that could potentially be possible for you in your scenario specific to your background. Okay. A mentorship. Mentorship is very critical. You can have this from someone you trust or from people like us, especially IMG Secrets, where we have a lot of board certified physicians and surgeons mentoring you. And many times having networking and connections can actually be a predictor of success, whether you like it or not. And a great place to do this networking is conferences. We have found that if you go to conferences, especially the big ones, for that particular specialty, they specifically have a residency section where you get to interact with a lot of program directors. Now, obviously, for IMGs, I do say that don't go and tell them, give me a spot, but rather show that how valuable you are and how interested you are in that particular program. Okay, just certainly make use of those networking options. Now, if you do need our assistance in anything, we are available at imgsecrets.com and imgrecruitment.com, where we help with recruitment specific to IMGs through all the non-US residency pathways, and also, of course, US graduates, where we work on a different level. Okay, so bottom line, I do want to conclude this because I want to spend more time taking questions from you all so I can provide direct value to you based on that. Okay, so I categorized whatever questions Marissa sent me into these different buckets. I specifically did not touch upon ERAS and the personal statement because I saw some excellent lectures. Those were covered in this. And whether you're an IMG, whether you're a local grad, the concepts are pretty similarly applicable to each of those. And hence, I covered all the other stuff, which could be slightly different for an IMG as compared to a US grad. Okay. And I'll be more than happy to take any questions you have. Thank you. Marisa, thanks for having me here.
Absolutely. Thank you so much. I'll get started on one of the first ones that came through. Post it here for you. I'm a current second MS2 at a new small Caribbean school without residency match rates and considering transferring to St. George after USMLE for better clerkships and chance for residency. Would that transfer hurt my application?
So let me see this. Can you post the question again, please? So current second year medical student at a new small Caribbean school without residency match rates. Sure, it's new. Considering transferring to St. George after USMLE for better clerkships. I don't think it should hurt your application. If at all anything, if you have a legit reason to explain why you had to transfer medical schools, I think it should work in your favor. So I would be supportive of doing this as long as you follow all the rules for transfer and you get the appropriate amount of credits in either places. You should be fine with the transfer. And we do see sometimes IMGs actually have a transfer of their medical school, and as long as the cumulative credits is good enough, you should be fine. Are Nigerian IMGs getting J1 visas? Now, one thing I have to remember is Nigeria under the list of banned countries? Now, assuming it is, I can't remember all the 39 countries that are on the ban list. Okay. If it's in the list of banned countries, then I do expect some difficulties in getting the visa, especially if it's a first time visa. But if you're not from a banned country, then no, I think Nigeria is no different from any other African countries or any other Latin American countries. So you should be able to get a J1 visa as long as you match into the program. Is general surgery IMG friendly? So what we've seen is IMGs tend to match in the transitional year of general surgery than in the categorical residency programs. So I would say yes and no. I would highly encourage you also focus on the transitional programs, not just categorical, just to increase the odds of you matching. Are there well-known resources or methods to check if certain sites are IMG friendly or not? US IMG from the Caribbean who is always hearing about the stigma. Well, generally the way you look for this is the biggest clue is would a program sponsor a visa? Then you would know that fine, they're taking IMGs for sure. They're just not focused on US citizens. You can look at the history of the programs over the last few years, like who they have hired and things like that. Then certainly you would find that whether a program is open for IMGs or not. The way we look at it is slightly different. Now, the example I give is let's say someone is hungry, really hungry. You give them any food, they're going to eat it, right? That's the way we look at it. So, generally, we do respect the IMG friendliness of a program to begin with. But at some point, if they can't fill, they're going to sponsor a J1 visa because sponsoring a J1 visa, Having been through the process of sponsoring a J1 visa myself through my workplace to an IMG, I know that it's very straightforward. Just a couple of signatures. In that year, it was $250. I can't remember the price right now. Very straightforward. And the visa was there in a few weeks. So the J1 visa sponsor per se, I don't see it being very difficult. Hopefully that answers your question. Being old IMG significantly affects the matching outcome. I would say an old IMG who's defined as an IMG who's more than 5 years post graduation can be inversely related to the success of matching. But having said that, see, the old IMG is alone not an issue. They look at your step 2 CK scores, they look at your overall package, they look at what you've been doing recently. As long as you're able to provide all these in a nice way, they should still be hope. I have to tell you, even in stronger candidates, sometimes you don't see them not match. But you do have to provide yourself with a strong application, with a perfectly crafted application to increase your odds of matching. So just because in an old IMG, I still encourage you to try to apply for the match, ensuring you create stellar application. How do you decide preference signals as an IMG? Do geographic signals need to align with program signals as well? The signals for an IMG is not significantly different from a signal for a US grad. A signal is the way we see it. In general, yes, a geographic signal should align with a program signal. So the way you think about it is, now let's say you're focused on New York. Like, why are you focused on New York is something you may want to say specifically, especially if you pick the Northeast as your geographical preference. So generally, for most of you, I would prefer you pick a geographical preference and you have a legit reason for picking it, not because you picked it because you want to pick it. And then you can focus your signals on those areas and you can be very transparent about it during your application, that this is the reason why I want to focus on these areas and this is why I'm picking this as my geographic interest. If I can only complete one US rotation, how do I make it count? Is that a disadvantage? I don't think so. One of the problems I see is, let me think of a good example. All right. One of the thing I see is someone is interested in, let's say, ophthalmology match, but they go and do a rotation in OBGYN. I find it hard. Like, how the heck are they related? So you have to decide on how this one rotation is directly related to the specialty you're applying for. No, definitely it's not a disadvantage. In fact, we've seen matching, the people matching, even without any US rotations. Okay. So you don't have to lose your sleep that you don't have US rotations, but you rather have to provide value in your application in such a way that relates that why that one rotation is critically important for your specialty and how you can match into that specialty. So you're good to go, basically. Make sure that you get all your LORs in a proper way. So you could get your LORs from your home country. Now, one of them would be the US from the place you rotated. And for if any of you did not have any US rotations, then in your case, all your LORs would obviously come from your home country. Okay. And that is the way you would approach this situation. Okay. What is something I can do now to improve my application in the next 90 days? See, this is a strategy that has to go on a long term, but if it's something you have to do immediately, then the first thing I would do is make sure you close your clinical gap. The clinical gap can be a big problem. So I would focus on that. And second is try to see if you can attend any conferences, any workshops that is relevant to your specialty, and try to see if you can get involved in any ongoing research projects. You can get in any leadership activities, become members of respective organizations. For example, pediatrics, American Academy of Pediatrics. Now pick the option where you have to pay the least amount of money as an IMG. And that usually costs not more than $50. I can't remember the exact for all specialties, but they're generally quite cheaper. Now, these are some of the things you can do to add a few more lines in your CV, which is what I highly encourage each of you do. Who is the ideal candidate to explore alternative pathways instead of pursuing another match cycle immediately? Generally, if you are a person who has already completed your residency in your home country or anywhere outside the US, excluding Canada, because Canada has a very different pathway, then you are probably a candidate who can certainly explore the alternative pathway. Now, this is a pathway that exists across almost all specialties, and any hospital in any of the 50 states, not any hospital, but select hospitals in any of the 50 states can actually offer you these positions. So you would be an ideal candidate for that. The only thing is your CV has to be pretty strong to bypass residency and then transition through these non-US residency pathways. Now, for full disclosure, so I actually have transitioned to the US myself through non-US residency options through the alternate entry path myself. Okay, so my residency is actually from India, and I have done a fellowship in Canada, and then I transitioned to the US as a staff. And that's how I became board certified in anesthesia and then in pediatric anesthesia, which is why I refer to as double board certified. Okay. All right. What can IMG who has fairly good board scores, completed step 3, has strong LORs in RATs and other clinical specialties, but has minimal research do at this point to strengthen their application? So you already have fairly good board scores. You've completed USMLE step 3. As I said earlier, I think the key is clinical gap. I personally see a clinical gap to be a major problem in many applications. So try to fill that if you can, and also focus on exact same things. The way you want to think is how I can accomplish myself in the space of education, in the space of research, in the space of leadership. Now, all these are the things that you as a doctor will be evaluated not only for your residency, but for your fellowship, but when you apply for staff jobs, when you apply to be a chief, a chair, or whatever it is. Now, these are the things that actually would play a bigger role. And this is how you start thinking about how you build your CV starting today, not only for your residency, but for your career. Okay? Great. Lots of questions. Love it. As an international and diagnostic radiology dual applicant, would it be recommended to write separate personal statements for each specialty, or would it be appropriate to write only one for IR, since this is the ultimate goal and I only plan to apply to integrated IR and DR with, what is it? ESIR?
ESIR programs.
ESIR programs. I don't know your complete background, but if I were you, assuming you don't have a strong background, I would probably focus on diagnostic radiology. And then once finishing the diagnostic radiology fellowship, probably focus on doing a fellowship in interventional radiology, and then establish your career in interventional radiology, plus even be a dual trained IR and DR, where we have seen people who work both in IR and DR, but then you would have a choice whether you need to focus on IR and DR. Now, if I knew your background, I would be able to comment if IR Soul would be a good choice. Now, if you're applying for an integrated IR DR, then obviously you're good with one personal statement. But if you plan to think of them as two different specialties, then obviously you need two different personal statements. IR and DR for the most part are integrated. It's the same department of radiology which offers both diagnostic and interventional radiology. But I would follow the process of diagnostic to begin with, because sometimes matching in interventional radiology is slightly more competitive than in diagnostic. Okay? Okay, as an IMG, conflicted about which specialty to commit to, how do I navigate the match process? As I said, some of the IMG friendly specialties are IM, FM, pediatrics, pathology, sometimes psychiatry, and things like that. But you do have to look at critically your CV and think of, is there any experience I can demonstrate in any particular specialty? Now, for example, let's say you have done a research project in pathology, for example. Now, that would be a sign that you're probably more of a pathology candidate than other specialties. Now, when you're confused about specialties, then this is the way you would think of how to pick. Now, let's say you have a very flat CV, you have no idea what to pick, then obviously you're left with these four specialties. You have to make a determination as to how much money, how much time you have to invest to apply for each of these specialties, because match process is not cheap. It's a fairly expensive process, right? Okay. All right. My program strongly suggested there is nothing I can do to outweigh having to retake step one in almost no programs other than potentially lower rank community programs will read my application. Is this true? I have no context as to what program is this. Is there anything I can do make self worth considering? Here's the thing. Now think about this. I actually don't know the context. Marisa, please leave the question on the screen. And let's say this is true for the purpose of discussion, that no programs other than potentially lower rank community programs will read your application. I would take this as a positive thing, that they're helping you out in saying apply to community programs that are not ranked very high. Because here's the thing, once you finish your residency, it does not matter where you finish from, you would still continue as a board certified specialist in that particular specialization. Now, where it matters is if you're thinking of being a chief of a place, a chair of a place, okay? If you're thinking of being a CEO of a hospital and things like that. Now, that is where it could change some of the things. But apart from that, if this is your background, I would not feel disappointed, but rather I would thank them for giving you some guiding light here and then focus on those community programs. Nothing wrong with that. People complete their residency there, they're happy, they complete, they become board certified, they start working. Okay, that's the way I would think about it. Don't feel bad. See, if you talk to 100 people, you'll hear 1,000 different opinions. Okay, so think of what best works in your situation. All right. Thanks for your time. It's my pleasure. I would like to know, based on your experience, how many programs would be a good idea to apply for internal medicine as an IMG with the year of graduation 2020 and just 3 gold signals, 12 silver signals? You know, this is a very hard question to answer. So generally, I would say if cost is not prohibitive, you can actually cast a wide net. But if cash is prohibitive, if you do have to pick a number, I would do at least 40 to 50 programs. Okay. So just to increase your odds of finding a place. Again, you would exclude all the bigger programs. You would exclude all the well-known programs. You can pick the community programs that actually make sense to your situation. There is no hard number. Okay. It's a very individual scenario based, but definitely don't do less than 15 is what I would say. Ideally 50.
On behalf of everyone at TrueLearn, thank you again for spending the time with us. We wish you all the very best as you prepare for your applications, interviews, and ultimately the match. Take care and best of luck. We hope to see you again at a future TrueLearn event.
Wish you the best, each of you. Thanks, Marissa.
Thank you.